Good morning, everyone. My name is Atahan. I'm from I'm a research fellow at HSS in New York City. Today, I will be presenting our study about the variations in spinopelvic parameters from sitting to standing changes. Okay. So first of all, as everybody knows, sagittal alignment is one of the most important factors in spine surgeries. However, current guidelines mainly focused on standing sagittal alignment, despite many patients spend their time mostly in sitting position. The aim of our study is to explore how spinopelvic parameters change from sitting to standing position and have factors like age, BMI, and gender affects these changes. So the primary aim of this study was to understand positional changes of 4 key spinopelvic parameters, which are pelvic incidence, pelvic tilt, sacral slope, and lumbar lordosis. Our previous studies have often investigated a small sample of young and healthy volunteers, which is a rarely encountered demographic in adult spinal deformity patients. Our study group had included a broader and much more similar patient demographics to deformity patients. So we made a retrospective analysis with 1,450 patients who were under consideration for the hip replacement surgery, as you can see here. And the main changes, the primary outcome of this study was the changes in spinopelvic parameters, which were calculated by extracting sitting values from the standing ones. You will find the patient demographics of our cohort. A mean age was approximately 63, and a mean BMI of 29, and a mean PI of 52. And also, you can find here our gender distribution was fairly balanced within the group. So in this slide, on the left side, you will see the mean, median, and standard deviation of the spinopelvic parameters in the standing position, and on the right side you will find the similar values in the sitting position. When you examine the figure, you will see that pelvic tilt and pelvic incidence were increased. However, sacral slope and lumbar lordosis were decreased with the positional change. And in the following one, you will see the scatter plot analysis of these changes, which were all significant. Once again, lumbar lordosis and sacral slope were mainly higher in standing position. On the other side, PT and PI were higher mainly in the sitting position. And in this slide, you will see the results of the multiple linear regression analysis. You can follow the significance levels on the right side with the asterisks above the coefficient numbers. So in the first line, you will see that older age had positive associations with changes in PI and PT. However, it had negative associations with changes in SS and LL. In the following line, you will see BMI was negatively associated with changes only in PI and PT. And finally, females were linked with increased changes in PT. On the other side, females were correlated with decreased changes in SS and LL. We have some limitations to consider in our study. First of all, our study population included many patients with hip osteoarthritis, also due to the nature of being hip patients. Also, we didn't have the patient-related outcome measures of the study group. And finally, you can see an extreme example of that. Some hip patients didn't have an ideal position in the standing X-rays. So to summarize, we found significant changes in spinopelvic parameters between the sitting and standing position. PI and PT were increased, and SS and LL were decreased. Also, we found a significant change in PI slightly. This situation raises clinical questions about the role of SI joint fusion in the long ASD reconstructions. We also found a significant impact of age, BMI, and gender on these changes. And finally, our future studies will focus on explore the role of SI joint motion in the long SI joint fusion of the ASD patients, and also better understanding of sitting alignment to improve help improve surgical outcomes, especially patients with high spine mobility between these two positions. Thank you for your attention.